I want you to picture something with me for a moment. Picture your kitchen right now. The counter, the cabinet, the spice rack. Everything looks completely normal. Everything looks safe. But what if I told you that somewhere in that kitchen, in your refrigerator, in your pantry, maybe even in the mug you used this morning, there is something that is quietly, slowly, relentlessly clogging your arteries? And what if I also told you that somewhere in that same kitchen, there is a combination of ingredients so powerful that when you drink them together every single morning, your body begins to fight back against the plaque that has been building up for years? My name is Dr. Robert Hayes. I'm an internal medicine physician with nearly 30 years of clinical practice. I've sat across from thousands of patients, good people, folks who thought they were doing everything right, and had to deliver news that shook them to their core. A blocked artery, a heart attack they never saw coming, a stroke that changed everything in a single morning. And every single time, I ask myself the same question. What could we have done differently? What could we have changed earlier, before it got to this point? That question has driven my research, my practice, and the reason I'm talking to you today. Because today, I'm going to give you something real, something actionable, something you can start using tomorrow morning when you wake up. And I need you to stay with me all the way through, because what I'm going to show you in the second half of this video is the most important part. Before I show you the morning drink, I need you to understand what we're actually fighting. Your arteries are the highways of your body. They carry oxygen-rich blood from your heart to every single organ, every single tissue, every single cell. When those highways are open and clear, life flows. But when they start to narrow, everything changes. Think of your arteries like pipes in an old house. When those pipes are clean, water flows freely. But over time, deposits start to accumulate on the inside walls. The pipe doesn't burst right away. It just gets narrower and narrower until one day the flow stops completely. That is atherosclerosis. That is what happens when plaque, made of cholesterol, calcium, and fat, builds up inside your arterial walls. The process is silent. There's no warning light. There's no pain signal until it's often too late. Heart disease caused over 683,000 deaths in this country in a single year. One death every 46 seconds. And the underlying driver of the majority of those deaths is arterial plaque. I've had patients tell me they felt completely fine the week before their heart attack. That's what makes this condition so cruel. It doesn't send you a warning. It just builds and builds and builds until the dam breaks. So when I tell you that what you drink in the morning matters more than most people realize, I need you to hear that as the honest truth from a doctor who has seen this disease take people far too young, far too fast. Now, before I show you the morning drink, I want to walk you through what I call the 4 silent destroyers of your arteries. Because the morning drink alone is only part of the solution. And I promise you, at least one of these 4 is going to surprise you. At least one of them is something most people consider completely harmless. Are you ready? Let's go. Enemy number 4 is one that almost nobody talks about. It's not a food, it's not a drink, it's something you do. Or rather, something you don't do. Sitting. Chronic, prolonged, uninterrupted sitting. I can already hear some of you saying, "Come on, Doc, really? Sitting?" But listen to me. When you sit for extended periods without moving, blood flow in your lower body slows dramatically. The endothelium, the protective inner lining of your arteries, becomes less active, less capable of doing its job. Think of your arteries like a river. A flowing river is clean, oxygenated, alive. But a still pond? That's where things accumulate. That's where things get stuck. Prolonged sitting turns your arterial river into a stagnant pond. And beyond that, sedentary behavior promotes insulin resistance, which is one of the most powerful drivers of atherosclerosis we know. When blood sugar stays elevated too long, it damages the arterial wall. And those micro-injuries? That's exactly where plaque begins to form. So what do we do about it? First, break up your sitting every 45 minutes. Stand up, walk around the room, march in place. Second, take a 10-minute walk after your meals, especially after dinner. Research shows this dramatically improves post-meal blood sugar control. Third, aim for at least 30 minutes of cardiovascular movement every single day. Fourth, if you can, try a standing desk or simply stand while you're on the phone. Fifth, remember this: motion is the lotion your arteries crave. Every time you move, you are bathing your arterial walls in fresh, oxygenated blood. Every time you sit for hours, you are depriving them of exactly that. Enemy number 3 is one that makes people uncomfortable, because it's socially accepted. It's at every party, every dinner, every celebration. Alcohol. There is research suggesting moderate alcohol may have minor benefits for some people. But here's what that research doesn't say loudly enough. Even moderate, regular drinking triggers inflammation in your arterial walls. It raises triglycerides, the fat in your bloodstream that feeds plaque formation. It elevates blood pressure, and over time, it damages the endothelium. Picture your arterial wall as a freshly painted surface, smooth, intact, protected. Now, imagine spraying it regularly with a mild acid. Not enough to destroy it all at once, just enough to roughen the surface, to create tiny cracks and imperfections. And then imagine cholesterol particles looking for somewhere to land. Rough, cracked arterial walls? That's exactly where they settle. That's exactly where plaque builds its home. So what do we do about it? First, reduce frequency before you reduce quantity. Daily drinking is harder on your arteries than drinking 3 times a week. Second, when you do drink, red wine offers some antioxidant protection over spirits. Third, always drink water alongside alcohol to reduce concentration of inflammatory compounds. Fourth, give yourself at least 3 to 4 alcohol-free days per week and watch your blood pressure respond. Fifth, replace the social ritual with something that actually helps. Green tea, pomegranate juice, or the morning drink we are about to cover. Write this down. Your arteries don't know the difference between a celebration and a slow assault. Enemy number 2 is the most underestimated enemy on this entire list. Sleep deprivation. Chronic accumulated sleep debt. Not one all-nighter. I mean the slow erosion of sleep quality and duration that happens to millions of people night after night. When you don't sleep enough, and enough means 7 to 9 hours for most adults, your body does not get the chance to repair the micro-damage that accumulates in your arterial walls during the day. Think of sleep as the construction crew that comes in at night to fix the potholes in the road. During the day, traffic creates wear and tear. During sleep, the crew patches, repaves, restores. Cut sleep short. The crew doesn't finish the job. And years of this? That's how arteries age decades faster than they should. Sleep deprivation also dramatically increases C-reactive protein, CRP, the inflammation marker in your bloodstream. Studies are clear. People who consistently sleep fewer than 6 hours per night have significantly higher rates of atherosclerosis than those who get 7 to 9. Not a small difference. A significant one. So what do we do about it? First, set a consistent sleep and wake time. Even on weekends, your arteries thrive on circadian rhythm. Second, Eliminate screens for 60 minutes before bed. Third, keep your bedroom cool, between 65 and 68 degrees Fahrenheit. Fourth, avoid eating within 2 hours of bedtime. Fifth, if you snore heavily or wake up exhausted despite getting enough hours, talk to your doctor about sleep apnea. Because untreated sleep apnea is one of the most aggressive accelerators of arterial damage I have ever seen in clinical practice. Write this down. Every night you sleep well, your arteries are getting younger. Every night you don't, they're paying the price. And now, enemy number one. I need you to take a breath right now and really hear what I'm about to say. Because this is the one that has broken my heart more times than I can count. The one that is so common, so deeply embedded in daily life, so aggressively marketed, that most people genuinely don't realize what it's doing to them. Enemy number one is refined sugar and refined carbohydrates. The white flour, the sweetened drinks, the breakfast cereals, the crackers, the cookies, the pastries, the things that have become the foundation of the modern diet, the things you probably had some version of this morning. In nearly 30 years of medicine, I can tell you with absolute certainty that there is no single dietary factor more consistently correlated with arterial plaque than chronic consumption of refined sugar and refined carbohydrates. Not saturated fat, not dietary cholesterol. Sugar. Here is how it works. When you eat refined sugar or refined carbs, your blood glucose spikes rapidly. Your pancreas floods your bloodstream with insulin to bring that sugar down. Over and over, meal after meal, day after day. And over time, your cells stop responding to that insulin signal. You become insulin resistant. And insulin resistance is the most common underlying driver of atherosclerosis we know. But it gets worse. Picture what happens when you melt sugar in a pan and let it burn. It hardens. It sticks to everything. That is almost literally what excess sugar does to proteins in your blood and arterial walls. A process called glycation. Sugar molecules attach to proteins and create advanced glycation end products. I call them AGEs. Think of them as rusty bolts in the structure of your arteries. They make arterial walls stiff, brittle, and prone to cracking. And cracked arterial walls are where plaque loves to build its home. Simultaneously, refined sugar triggers systemic inflammation, elevates dangerous LDL cholesterol particles, raises triglycerides, suppresses your good HDL cholesterol, and damages the endothelium. 5 simultaneous attacks. Every single time you consume it in excess. 5. And this is the thing that is sold to your kids at the checkout counter. This is the thing that is in almost every processed food on the shelf. Every time you say no to that afternoon soda, you are protecting your arteries. Every time you choose oatmeal over a sugary cereal, you are actively fighting plaque. Every time you read a label and put something back because it has 30 grams of added sugar, you are doing more for your cardiovascular health than most medications I can prescribe. That is not an exaggeration. So what do we do about it? First, cut out all sweetened beverages, sodas, sweetened teas, energy drinks, flavored coffees. These are the single highest source of refined sugar in the modern diet. Second, replace refined grains with whole grains. The fiber slows sugar absorption and feeds your gut bacteria, which plays a huge role in arterial health. Third, eat more protein and healthy fat at every meal. They slow sugar absorption and reduce insulin demand. Fourth, use natural sweeteners when you need sweetness. Raw honey in small amounts. Fresh fruit. Fifth, read every food label and treat anything with more than 10 grams of added sugar per serving as an occasional food, not a daily staple. Write this down. Sugar doesn't just make you fat, it makes your arteries old, stiff, and sick. Now, I promised you the morning drink, and I'm going to deliver. The 5 ingredients in what I call the arterial flush protocol are raw garlic, fresh ginger, turmeric with black pepper, fresh lemon juice, and warm water. Let me walk you through each one. First, raw garlic. Garlic contains a compound called allicin. I call it the arterial guardian. When garlic is crushed and allowed to sit for 10 minutes before consuming, allicin releases in its most potent form. It has been shown to reduce LDL cholesterol, lower blood pressure, and slow the accumulation of plaque inside coronary arteries. For your drink, use 1 small raw garlic clove. Crush it. Let it rest 10 minutes, then add it. Second, fresh ginger. Ginger contains gingerol, the inflammation extinguisher. Gingerol is one of the most potent natural anti-inflammatory compounds we know. It reduces oxidative stress in vascular walls, improves circulation, and lowers LDL cholesterol and triglycerides. Use about 1 inch of fresh ginger root, grated. Third, turmeric with black pepper. Turmeric's active compound is curcumin, the plaque fighter. Curcumin reduces CRP, prevents LDL from oxidizing into its most dangerous form, and supports endothelial function. But here's the critical part. Turmeric alone is poorly absorbed. You need black pepper. The piperine in black pepper increases curcumin absorption by up to 2,000%. Always take them together. A 1/4 teaspoon of turmeric powder with a pinch of black pepper. Fourth, fresh lemon juice. Lemon is loaded with vitamin C, which is essential for collagen synthesis in your arterial walls. Healthy, flexible arteries depend on strong collagen. Vitamin C also neutralizes free radicals that oxidize LDL and trigger the plaque-building cascade. Use the juice of half a fresh lemon, not bottled. Fifth, warm water. Not hot, not cold. Warm water on an empty stomach stimulates circulation and improves bioavailability of every compound in this drink. About 8 ounces. Here is the complete arterial flush protocol. Crush 1 small raw garlic clove and let it sit for 10 minutes. Grate 1 inch of fresh ginger. Mix a 1/4 teaspoon of turmeric with a small pinch of black pepper. Squeeze half a fresh lemon into 8 ounces of warm water. Add everything together, stir well, and drink it first thing every morning. Before coffee, before breakfast, before anything else. On an empty stomach, this combination goes directly to work on your arterial walls. It takes less than 5 minutes to prepare. It costs less than $1 per serving. And the cumulative effect, practiced consistently over weeks and months, is one of the most powerful dietary interventions I know of for cardiovascular health that doesn't require a prescription. I know this is a lot to take in, and I understand if it feels overwhelming, but I want you to hear something genuinely hopeful right now. The research gives us real reason for optimism. Studies consistently show that dietary interventions can slow and, in some cases, partially reverse the progression of atherosclerosis. I have watched patients who committed to changes like these come back 6 months later with lower inflammatory markers, improved blood pressure readings, and better cholesterol panels than they had in their 40s. It is not too late. That is not a platitude. That is what I have witnessed firsthand. Let me give you the complete 5-step daily protocol you can start tomorrow. Step 1. Drink the arterial flush protocol every morning on an empty stomach. Step 2. Cut all sweetened beverages starting today. Replace them with water, green tea, or unsweetened herbal teas. Step 3. Eat a fiber-rich breakfast every morning. Oatmeal with berries is one of the best options on the planet. Soluble fiber binds to LDL cholesterol in your gut and carries it out before it ever reaches your arteries. Step 4. Move your body for at least 30 minutes every day and break up long sitting with movement breaks. Step 5. Protect your sleep. 7 to 9 hours. Consistent schedule. Cool, dark room. This is when your body repairs the arterial damage from the day. Don't skip this step. Breaking free from the habits that damage your arteries is not punishment. It's the best investment you will ever make. In your heart, in your brain, in your ability to be present for the people you love for years and decades to come. We've covered a lot of ground today, folks, and I am genuinely glad you stayed with me all the way through. We talked about what arterial plaque actually is and why it's so dangerous precisely because it's silent. We talked about the 4 enemies of your arteries: chronic sitting, regular alcohol, sleep deprivation, and refined sugar, and exactly what to do about each one. And we walked through the arterial flush protocol, the 5-ingredient morning drink you can start making tomorrow. My goal today was never to scare you. My goal was to give you the tools to fight back. Your arteries are not just pipes. They are the infrastructure of your life. They carry the blood that feeds your heart, your brain, your eyes, your kidneys, your legs. When they are open, clear, and healthy, you feel it in your energy, your clarity, your capacity to live fully. And now you have a morning ritual that fights for them every single day. Before I go, if this video gave you something valuable, please share it. Send it to someone you love, a parent, a sibling, a friend who you know isn't taking care of their heart. That share might be the most important thing you do today. And subscribe right now if you haven't already. Hit the bell so YouTube notifies you every time I post a new video. I cover heart health, metabolic health, and real clinical medicine every single week. Drop a comment below and tell me, which of the 4 enemies surprised you the most? I read every single comment. Thank you for spending part of your day on something that truly matters. Take care of your heart, and I'll see you in the next one.